Hi, my name is Mike. I'm here with Vegas Fitness, and I'm going to talk to you a little bit about the shoulder today. More specifically, what we do as personal trainers at Vegas Fitness to help our clients who have shoulder problems or even just want to strengthen the shoulder. So the first thing you want to know is, what is the shoulder? How do we look at the shoulder? The shoulder, like the hips, we have two hip bones here. We got two scapula here. They help stabilize and protect the shoulder. And in order for us to move this shoulder above our head in different directions, we need to have a stabilizing bone here, anatomical structure here. So this scapula sits on the back. It actually comes around and connects with the collarbone or clavicle here. And then the head of the humerus, which is the upper part of the arm here, will actually sit into a ball and socket joint, much like your hips. So the big thing that we're finding is there are quite a few muscular attachments. So a bunch of the muscles from the back up the lateral side here come up and attach onto the scapula itself. So in order for us to have a stabilizing structure, we have to have strong stabilizing muscles in the midline, down through the lower portion, around the side, and here on top. Now, in order for us, we're seeing a lot of our clients come in and they can't raise their hand above their head, or their shoulders hiked up. We have a lot of people who are working on computers and the shoulder rolls forward. That places a lot of stress on those muscles, and then the tension eventually over time, they lengthen, they stay that way, they harden, and we lose range of motion through not only the shoulder, but that will radiate down into the hips and could even go down into the foot. So what we want to do here at Vegas Fitness is identify any limiting structures. So for example, if Adam raises his hand right out in front, we're just going to look here at the back and just find out if any of the muscles are limiting in allowing that shoulder blade to kind of extend, rotate, and come up, elevate. In this case, no, and then he's going to come back down. He's going to do the same thing with abduction. He's going to raise that arm out to the side. Any limiting factors? Not so much in Adam here, but we're also trying to make sure that he's free of the other tissues and the other structures in the body. And another thing is, a lot of pain comes from what people have described as, or they hear as, the rotator cuff. So what is the rotator cuff? The rotator cuff is deep muscles of the shoulder. Their tendon, so the attachment from the muscle to the bone via tendon, actually creates a capsule and a cuff in the shoulder, and overuse from rotation or overhead lifting, anything like that, there's this actual muscle that sits on top, and every time you go up, this part of the shoulder is going to collapse down, and every time it collapses down, it causes a little bit of hardening to that muscle. So most of the time when we see the rotator cuff stuff is the muscles or the tendons that allow for that mobility become hard, they lose that range of motion, and you're limited in your range and you get that kind of pain. Or if there was some sort of trauma and tightness, then we see a lot of limitations in external rotation. Just again, the tendon was injured or the muscle was injured, and it wasn't able to return back to its free range of motion. So some stuff we'd like to do here are some mobility exercises. Well, one of our favorite ones here is a landmine exercise. So maybe we want to return our client back to a overhead press, but they're just not quite there. What we want to do is create a good base, set the core, keep the hips loaded, arm slightly abducted, and you're going to press straight out. Again, it's not overhead, but he's having to use a stabilizer here. He's having to bring the shoulder blade back and stabilize here, and we're still getting range of motion through the shoulder. So eventually, by doing this, we're hopefully getting better range of motion, some better strength, and we want to eventually return to an overhead press.